one question that is behind the whole e-cigarette thing is one thing. Is nicotine bad for health?
So, nicotine itself is not what causes the vast majority of problems within smoking. It is the carbon monoxide that you get when you burn the nicotine, burn tobacco, and the tar and thousands of other chemicals in there. One reason we know that is, as a physician, I have at this point prescribed thousands and thousands of nicotine patches for people over the years, nicotine gum and lozenges. And those are all reviewed by the government here, by our Food and Drug Administration, and found to be effective at helping people to quit smoking and generally safe. So it's not the nicotine that's killing people. It is the way that it's taken. And so e-cigarettes hope to get around that by you're not burning it. The temperature, it's a different process, so it doesn't generate carbon monoxide. And
There's no combustion.
yeah, you're aerosolizing it, and it doesn't generate those other thousands of compounds. Now that said, there is still the risk that there are compounds in e-cigarettes like propylene glycol, which gets broken down when it gets vaporized, and we're still looking at what the long-term effects of those are. No, and this has been one of the arguments in the field as well. You have no idea what this is going to do to people 30 years down the road. And I agree completely. I have no idea what's going to do 30 years down the road. On the other hand, I know that cigarette smoking is about one of the worst things that you can do in health. And so it would have to be worse than that. And we haven't seen those signs so far. So nicotine itself is not the problem. And the FDA here in the US, the Food and Drug Administration, talks about a spectrum of harm for nicotine, with cigarettes being the absolute worst. Then e-cigarettes probably being here, and nicotine replacement being here, and not smoking at all being, of course, the least harm.
Does it make sense to ban vapes while cigarettes are allowed in a country? That's the case of Brazil. That's why I'm asking you that.
I tend to think it doesn't because, everything, like I mentioned earlier, these have been more effective than nicotine replacement in getting people to quit smoking. I have colleagues who don't necessarily want to see that, but there's been study after study pooling together all the science, and they all show the same thing at this point. These are effective at helping people to quit smoking. At the same time, the US is a great example for what can happen in an uncontrolled market where all of a sudden you have a third of young adults using this product and harming themselves. And who wants to see that in a country? I've been countries where they are illegal, but it's still very commonly used because they're very easy to get to bring in your suitcase and things like that. And so I'm not sure that completely banning them doesn't always work completely because people manage to get a hold of them. But it has to be done carefully for the reason I mentioned, that you don't want to cause more harm than good.
When you say e-cigarettes are more effective than other tools, how more effective they are? Can it be quantified?
Well, one of the big studies came out about 5 years ago in one of the leading journals, the New England Journal of Medicine, and a gentleman in London did a trial where they randomly assigned people to either e-cigarettes or nicotine replacement therapy. And at the end of the year, the rate of being off of cigarettes completely was 19% versus 13%. So that was a sizable difference. And in sort of more general terms, I think of all of the different types of nicotine replacement that we have kind of double your chances of quitting. And e-cigarettes have been consistently shown to do more than double the chance of quitting when you look at these studies where they compare the two. So it's hard to put an exact number on it, but this the one study where they pooled together all the available science to date has just gotten more and more clear that this is not open for debate anymore. They say that they are more effective. There are other medications out there, like in the US, varenicline triples somebody's chances of quitting. And I haven't seen the extent to which e-cigarettes would compare with that. I also look at it pragmatically as that I am always looking for ways to get my patients who use tobacco to smoke. And I'll sort of take whatever I can get, even something that may still have some risks itself, but is substantially less harmful. And so I tend not to obsess as much over, it does nicotine replacement double it, and this make it 2.4 or 2.5 times. They both work. And the biggest benefit for somebody is getting off cigarettes completely. But what I've liked about the possibility of e-cigarettes is that it's an immediate solution. Prevention, like keeping kids off of cigarettes, will help us lower death from tobacco 30, 40 years down the road. But e-cigarettes have the potential to lower deaths now.
Poder Monitor. Acesse agora e ganhe 30 dias grátis.